Let me just scroll from top to bottom so you get a flavor of what I'm about to talk about. Clearly, this is very abnormal looking lung. As always, I'm looking at the distribution of disease. Seems to be everywhere, although maybe there's a bit more in the mid and lower zones compared to the lung apices. Then the crucial thing is on HRCT. What are the patterns? What are we seeing that's so abnormal? Well, the first thing we're seeing is these areas of low attenuation, which are, everywhere you look, defined by a thin wall. So these are, by definition, pulmonary cysts or pulmonary air cysts, as they're sometimes called. They're of varying sizes, they're of varying shapes, and as I've said, we're seeing them virtually in all zones, although there is a greater profusion in the lower zones. But there's more. We're also seeing areas which are looking very solid. There's a large one at the front here, and they are present in both hemithoraces. So what are they? Well, before we go into what are they, let's just have a look at a different image recon. So this is a soft tissue recon, and this clearly shows that those large lumps that I've highlighted are dense, and they are of high density. This could be calcium, or it might be some other material. Let's go back to the lung recons. Here we are again looking at the lung recon. So we've certainly got pulmonary air cysts, and we've got these large masses. Those large masses are of very variable shape and very variable size, but some of them are up against the pulmonary air cysts. What about lung density? Well, lung density does vary a little bit, and I'm just going to change the window setting slightly by doing that, and we will see that there is a slight differential in lung density. Now, I'm not talking about the cysts that we've talked about. I'm talking about the homogeneity, or indeed the lack of homogeneity of lung density. So there is a mosaic attenuation pattern. And my guess is that mosaicism reflects a component of small airways disease. So we've got large cysts, we've got masses. Those masses almost certainly represent deposits of amyloidosis. And then there is this component of small airways disease manifest as a mosaic pattern. And this is something that we see in the pattern of lymphocytic interstitial pneumonia, or LIP for short. And this occurs classically in patients with this condition called Sjögren syndrome, which is an autoimmune disorder. And that's what we're looking at in this patient.